Hi everyone, welcome to the Talk with the Doc show. My name is Dr. Shireen Banakta. I am your corrective care chiropractor as well as functional nutrition and detox specialist. And today we're talking about dandruff and the root cause of dandruff. So we all know what dandruff is, and it's that white, yellow, dry skin flaking off of our scalp. And the condition can be embarrassing for some, especially when it's affecting the visible area or leaving visible flakes on dark clothes. It can also be uncomfortable. It can cause itchiness. And the good news is that you don't really have to deal with the discomfort and embarrassment of dandruff anymore. There are so many natural support strategies that can help to improve your health. So today we're going to learn about what dandruff is, how it's different from just dry skin, and we're going to go over some signs and symptoms of dandruff, and we're going to go over some conventional treatments that are available for you and some natural health therapies that are available for you. So what is dandruff really? Dandruff is a common condition. It affects our scalp. It is characterized by small pieces of dry skin that flake off of our scalp. It provides that white, powdery look, and it can be more noticeable, of course, if you have a dark hair or if you're wearing dark clothes, and those can land on your shoulder. So it's different from having a dry scalp. Having a dry scalp means that the skin on our head has too little moisture and it gets irritated. A dry scalp may start visibly flaking as well. So dry skin and dry scalp may develop from cold and dry hair. It can develop from contact dermatitis, from a shampoo, hairspray, or other hair products, or simply just older age. If you have a dry scalp, your face, arms, legs, or other body parts will also be dry. If you have dandruff for other reason, that means that the skin cells on your scalp die quicker and shed more and quicker than they normally should. As the skin cells renew, shedding old skin is normal. However, unless you have dandruff, it shouldn't be too visible or cause any other issues. So, dry skin is that small white dry flakes. It does have itchy scalp, and you're going to get dry skin on your body as well. But with dandruff, it's yellow or white oily large flakes. You're going to get itchy scalp, and you're going to have oily red and scaly skin. So what is the physiology of dandruff? Why do we get it? It can happen for many reasons, and the exact causes are not completely understood. There was a 2015 review that was done in Journal of Clinical and Investigative Dermatology, and they found that dandruff often develops because of what we call seborrheic dermatitis. This is a skin condition that causes oily red and scaly skin. This condition can affect our eyebrows, it can affect armpits, it can affect the groin areas, or anywhere else that you have oil glands. On your head, it causes that white or yellow scales that we call dandruff. Another common trigger of dandruff is Malassezia. This is a fungus that affects our scalp and may cause our skin cell to multiply more quickly than normal. Your hormonal health, your stress levels, your age, and other factors can affect this fungus and trigger more dandruff. The outermost part of the epidermis that makes up the dead cells. I'm going to talk about this in just a second. There was a 2012 review that was published in International Journal of Cosmetic Sciences. This was, and they looked at this healthy outer layer of the skin, the epidermis, and they found that this outer layer of the skin really helps hydration, reduces water loss of our skin, and it also serves as a barrier that protects our skin from chemical transfer through the skin, toxins, and harmful microorganisms like the fungus that we talked about. So if this barrier is chronically or seriously damaged, it can cause poor hydration, which can lead to a variety of issues, including atopical epidermal proliferation, which is what dandruff is. So it may also lead to inflammation and is an increased risk of skin irritation. So we talked about what the signs and symptoms are. They are different types of dandruff. There's actually 4 different types. Number 1 is our dry skin dandruff. These are small white flakes. Skin is dry, it just needs more moisture. Then you have the fungal related dandruff. This is triggered by an inflammatory reaction. Then you have the oily skin dandruff. This is producing excess oil that can lump together. It creates oily, larger flakes that are more yellowish than they are white. And then we have disease-related dandruff, like autoimmune or a chronic inflammatory disease, like a seborrheic dermatitis, eczema, psoriasis, that can cause dandruff. Seborrheic dermatitis is probably the most common, and it tends to occur in people with oily scalp and can cause redness, itchiness, and flakiness. Now, what are some of the things that we could do to help with dandruff? Well, there are some conventional treatment options. For example, because it's a chronic condition, there's a lot of over-the-counter shampoos that can help to reduce the oily skin and the skin buildup. The over-the-counter dandruff shampoo does not reduce dandruff after several weeks or months of use. So if it doesn't, then a lot of people go to a dermatologist and get a prescription strength antifungal shampoo. But there are some root cause factors that we have to look for. For example, genetics is one of them. One of the major root factors are dandruff that can increase our risk of getting it is genetics. There was a 2012 study that was done in British Journal of Dermatology. They looked at gene expression profiles of participants with and without dandruff and they compared it. The same study also found the effectiveness of zinc pyrethine shampoo for dandruff and found it to be potentially effective treatment study option, by the way. And what they found is that they are markers for inflammatory genes, for inflammation level genes, for lipid metabolism, for sebum production, that these were genetically related. Another thing we could, so we know part of it is genetics, but what if you have the genes? What are some of the things you could do? Well, following an anti-inflammatory diet would really help, because if you're having a diet that is full of things that are fried with bad oils, you have really little vegetables, you're eating a lot of sugar, then you're setting yourself up for that dandruff. You want to promote an anti-inflammatory diet. So this is a diet that is high in gluten-free stuff. It's a diet that's high in vegetables. Why? Because decreasing the overall inflammation in your body will decrease the overall expression of dandruff. Number 2 is leaky gut. If you haven't heard about it, I've made tons of videos on it. Go back and have a look. But there are microorganisms, there are microorganisms that are found in our gut. The gut microbe really affects the skin problems. So we really do have to look at healing the gut in order to make sure that any imbalances that those imbalancement of microorganisms are causing will go away. So in our office, we actually look at whether you have a leaky gut or not. There's a test that is done. And then based on that, we'll go on a healing gut diet. You also want to look at fungal growth. So a 2019 review published in Microorganisms and a 2021 review published in Microorganisms have both shown that there is a connection between our gut microbe health and our skin health. And one of the major causes of gut microbe and skin microbe imbalances can be a fungal overgrowth inside of our body. Again, this is something that we could test for. Low stomach acid levels are another one. So there was a review that was published that showed that if the stomach acid is low, then you are more prone to having fungal issues. Food sensitivities and histamine tolerance, again, they are tests that are done for food sensitivity, and you could look at them and there will be foods that will aggravate your gut, but they will also cause a microorganism imbalance, and they would also cause inflammation for you. So you really want to have a look at that. Vitamin D deficiency. We have an entire 30-minute video on the benefits of vitamin D and how do you boost it, the kind of supplements that you use. So go ahead and watch that. But if you don't know yet, vitamin D is probably one of the most vital vitamins. It is essential for your immune, bone, muscle, skin, and brain health. So there is no shortage of studies that shows that vitamin D really helps. Zinc deficiency is another one. They have found that if you have zinc deficiency, that increases your susceptibility to inflammation, And you want to make sure that you have enough zinc because not only does it boost your healthy immune function, it supports progesterone, it balances estrogen, it decreases the risk of any cancers, and it supports our P53 gene, which protects against breast and prostate cancer. So, anti-inflammatory nutrition diet, you want to make sure that you get your zinc levels and vitamin D levels tested. You want to test for any food sensitivities that you have and remove those. And if you have a leaky gut, you want to make sure that you heal that leaky gut. I hope that helped. And if you have any other questions, make sure that you reach out to us in any of our social media. All you need to do is to go to our website called www.harmonywellness-frisco. On the top left-hand corner is all of our social media. So engage with us. If you like this video, give it a 2 thumbs up. Have a fantastic day. This is Dr. Shireen Banakdar. I am your corrective care chiropractor. I'm also your functional nutrition and detox specialist. God bless. Remember who you are.